Next, Dr. Chitra.
Good morning, everyone. I'm Dr. Chitra, Senior Resident.
Mike.
This is a study on short-term effect of 2% pilocarpine on intraocular pressure before laser peripheral iridotomy. I have no financial disclosures. Primary angle closure glaucoma is a visually more destructive form of a disease than open angle glaucoma, and the blindness due to angle closure glaucoma is much more sight-threatening. Laser peripheral iridotomy is the treatment of choice in angle closure glaucoma, and pilocarpine eye drops are used in short-term management in order to prepare the eye before laser iridotomy as they induce miosis and stretch the iris. Studies shows that topical pilocarpine reduces intraocular pressure in an hour, and the effect lasts up to 48 hours with an IOP lowering effect of 20 to 25% on long-term usage. The aim of this study is to study and analyze the short-term effects of intraocular pressure changes after pilocarpine installation and before laser iridotomy. The study is done at Geetham Hospital. It is a hospital-based interventional study done over a period of 6 months in 60 eyes of 30 patients with diagnosed angle closure disease. Patients diagnosed with angle closure disease on gonioscopy were included in the study, and contraindications for pilocarpine use like uveitic glaucoma, neovascular glaucoma, phacolytic glaucoma were excluded. Any contraindications for laser iridotomy were excluded. Allergy to pilocarpine were excluded in this group. All the patients underwent a careful slit lamp examination, visual acuity is noted, applanation tonometry is recorded, gonioscopy is done. First, a baseline intraocular pressure reading is taken before instilling 2% pilocarpine, and then subsequently sequential intraocular pressure readings are taken for every 15 minutes in a span of 1 hour, and the percentage of IOP reduction is calculated. This is the case sheet pro forma containing the history and the anterior segment examination. Applanation tonometer readings were taken and gonioscopy is done. Coming to the gender distribution of the disease, this study is a female preponderant study with 77% of cases being females. Age distribution of study of the disease, we can see an increasing prevalence of the disease with increasing age, with almost 56.6% of cases in the age group of 61 to 70 years. Risk factors. Among the risk factors, hyperopia was found to be the major risk factor seen in 20 of the cases, followed by diabetes, followed by hypertension, anxiety, and family history. The mean intraocular pressure values before administering pilocarpine has a mean of 18.1 with a standard deviation of 7.82. The mean of intraocular pressure after administering pilocarpine is found to be 14.8 with a standard deviation of 6.39. There is a significant difference in the mean of the intraocular pressure readings before and after administering pilocarpine with a p-value of 0.001, which is significant on paired sample t-test. So primary angle closure glaucoma is a vision-threatening condition and it needs urgent laser iridotomy. Laser facility may not be available everywhere. A sustained raised intraocular pressure may lead to painful blind eye, and pilocarpine is used to facilitate eye before laser iridotomy. In this study, we have noted the short-acting effect of pilocarpine on intraocular pressure during the laser procedure. Before the laser, a significant reduction in IOP is noted with topical pilocarpine, which is in accordance with the Yunard A et al. Study, in which they showed that there is a significant reduction in IOP post-pilocarpine use. In conclusion, topical pilocarpine installation can significantly reduce raised intraocular pressure, and they can delay the adverse effects of angle closure crisis. This therapeutic property of pilocarpine can be used in glaucoma whenever necessary, provided there are no contraindications for its use. The drug can come handy in delays of laser iridotomy or in settings where laser iridotomy is not available. It can be a life savior of vision in delays of laser intervention. These are my references. Thank you.
Yeah, good, you are in time.